Hello and welcome to the fifth topic in the 6-session series of Living Well with AMD. In this topic, we're going to be discussing vision loss and mental health. So as I'm sure many people have already experienced, when you are diagnosed with AMD, there are both physical and emotional changes that you go through. And that's what we're going to be talking about today. So again, this is the fifth of 6 topics within the series called Living Well with AMD. And we're actually going to start off with a bit of a relaxation exercise. So if everybody could get comfortable in their chair, close their eyes, make sure you have some room in front of you, and begin breathing in through your nose, out through your nose, in through your nose, out through your nose. We're going to continue this and release each thought, any thought that we have in our mind, and focus solely on our breath. So you're going to want your breaths to be long and drawn out. So try and make your inhales and your exhales as long as you possibly can. You're also going to want to make sure your breaths are continuous, so that as soon as you reach the very top of your inhale, you begin exhaling without taking any pauses. The deeper your breath, the more you can feel your body engaged in your breathing. So as you inhale, you'll feel your chest cavity expand and then your belly will come out. And as you exhale, your belly will flatten and your chest will let out all of the air. Continue to breathe in through your nose and out through your nose. Again, try and clear your mind, freeing it of any thought you have. Now, after your next inhale, you're going to sigh for your exhale. So we'll go in through your nose and sigh as you exhale. In through your nose and a loud sigh as you exhale. Again, in through the nose and sigh as you exhale. Continue to breathe in and out through your nose. Now we're going to start to introduce some movement, keeping your eyes closed. You're going to wiggle your fingers and your toes, and then rotate your wrists and your ankles. Then you're going to stretch up with your hands, and while you are seated, I want you to lift your legs and stretch your feet out in front of you, giving your body a big stretch. So reach up to the ceiling with your fingertips and push your feet out as much as you can. And then finally, you're going to open your eyes. All Right, so that was a relaxation exercise just to clear our minds and get us ready for what we're about to discuss. That's something you can do anytime you're feeling stressed or overwhelmed. You can do it for as long as you like, and hopefully it'll bring you to a place of peace. So today what we're going to be talking about is healthy responses to loss and change. So vision loss, requires sort of an adjustment period for people. So what are some healthy ways that we can get through that? What are some ways that we can also stay on the healthy path during this adjustment period? Okay, so make sure that we're in check. We're going to be talking about how AMD and depression are related, some signs and symptoms of depression so we can recognize it, and also ways that we can better deal with it. And finally, we're going to talk about how we can live well with AMD. So before we begin, I would like to introduce you to a couple of people who are currently living with AMD. The first is Joe, and Joe is 82 years old. He has wet AMD in both of his eyes, and he was only recently diagnosed, although he said he noticed that something was different for years. For years, I would see little things, and they would always be a bit off. Lines would be a bit wavy, I rarely saw things straight, and then all of a sudden I couldn't even recognize people anymore. It was no bother to me though, really. It's not like I really wanted to see them anyway. I prefer to keep to myself. When asked how he came to be diagnosed, he said, "My son told me I should go to the doctor one day after I asked him what the heck the bear with the sombrero was doing in his living room." Well, it turns out it was my grandson in a cowboy hat. Joe was diagnosed with wet AMD in both eyes, and after his diagnosis, he was asked, "What has changed for you since finding out you have AMD?" He responded, "Oh, nothing's really changed. Well, I think things have changed for other people, but not for me." Now meet Mary. Mary is 72 years old. She's the grandmother of 2, and she has been diagnosed with dry AMD. She was diagnosed 9 years ago. So she was referred to an ophthalmologist by her optometrist following one of her yearly checkups. 2 months ago, she made an appointment after she experienced a dark spot in her vision, and she found out she had wet AMD in her right eye. I've always been very careful about my vision. My brother found out he had AMD, so I started to get my vision checked. And luckily I went when I did because the injections do seem to be helping. When asked how things have changed for her since finding out she had AMD, she had this to say. "Initially it was a shock. I was afraid because I knew my brother had lost much of his vision after he found out he had it. I was taking vitamins for quite some time actually before I was diagnosed, and I always take more than the recommended dose because I figure the more I take, the better it should work." When we asked how she's been doing, Mary responded, "My vision is still pretty good, but I don't know what I would do without my daughter's help. I call her before I do anything, and even though my vision hasn't really been affected, I ask that she always accompany me when I do groceries or anything like that. It's important that she knows what I like and what I don't like for when I can't do these things for myself anymore." Alright, so let's talk about what losses people here have experienced in their life. Hopefully participants will feel comfortable sharing any losses they've had, and they might elaborate on it. Just ensure that everybody's comfortable doing so. And hopefully we'll have more than one person sharing. So once they've told us a little bit of a loss they've recently experienced or they've experienced in the past, we're going to go ahead and ask, how did you respond to the change you experienced as a result of this loss? Again, we're going to give them an opportunity to elaborate and tell us how they got themselves through this. Not how they got themselves through this, but how they responded to it. So, for example, what feelings did they have? Were they really withdrawn or depressed? Then we're going to ask how they did, or if this is a recent loss, how they feel they can move forward from here on in. So what are some things they can do for themselves? What have they done in order to move forward? Okay, and so just talking about healthy responses to loss and change, we're going to take a look at Joe and Mary. And for example, Joe has not seen his optometrist in over 5 years, but recently realized that he needs to get his license renewed. So he requires a doctor's note saying that he'll be okay to drive. And upon visiting his optometrist, Dr. X, he learns that he's going to refuse to provide him with such a letter, stating, "Joe, you should absolutely not be driving." And Joe figures Dr. X is just being extra cautious and says, "You know what? I'll find someone else who knows what they're talking about." So after several attempts trying to find someone else who will sign the form, he comes to the conclusion that everybody's simply just off their rockers. Joe continues to drive around his neighborhood when he needs to. He says he thinks it would be safer in a car than it would be tripping and falling on the concrete. So how do you think Joe is coping with change? Alright, and hopefully the consensus of the group will be that he's not really coping. He's sort of ignoring any change. He's not accepting that, him driving is actually endangering not only himself but other people. His lack of vision could mean that somebody at some point could get very hurt. Now we'll talk about Mary. So Mary called her sister twice already to bring her to the store a few blocks from her house. Although she has yet to experience any vision loss, she can still legally drive and is completely mobile. She does not want to take any chances and is just trying to prepare for what's going to happen. Her daughter is actually with her children at a doctor's appointment, and when her mother calls her, she said maybe she could just take the bus. Mary couldn't believe her daughter would suggest such a thing. "People with vision problems can't take the bus. I need you to take care of me when my vision starts to go. You will need to do everything for me. You might as well start getting used to the idea now." So how do you think Mary's coping with the change in her situation? And hopefully, again, the consensus will be that she is dealing with it in a way where she is certainly preparing for the worst, which isn't always a terrible thing to do. However, she's sort of already given up any independence she has, and she still has the ability to be very independent. And even with vision loss, she would still have the ability to remain independent. But it's almost as though she's already lost hope, okay? And that's something that we'll discuss a little bit later as well. But the important thing to take away from this is that everybody's going to prepare for this change that might happen or has already happened in their own way. And although there's not really a right or a wrong way of dealing with this situation, so you could look at it as sort of grieving. There's not a right or a wrong way to grieve. Your preparation, it shouldn't endanger other people. Oftentimes people might feel as though they will be a burden to others, when this is not the case. So, you always also have to put yourself in someone else's shoes. If another individual needed your help, would you be willing to help them? All right. So then we're going to go ahead and ask the group, what have you noticed losing? Let's say after being diagnosed with AMD or even before that. I'm going to try and make this relevant to age-related macular degeneration. So some of the answers could be reading, that's a big one, driving, recognizing faces, a lot of activities that they used to be able to do. So driving probably going to be the most intense loss. And then what are some feelings you have about possibly losing these things or the fact that you have already lost them? Again, some expected answers will be sadness, anger, frustration. They might be embarrassed, or even they might be afraid. So each time a group member suggests a feeling, it's important to ask them to elaborate a little bit. So tell me more about that, and hopefully they'll open up. So what do you think are the best ways of dealing with feelings of sadness? So oftentimes our mental health relies on those little breaks that we take for them. So although it might not be a permanent solution, just relieving yourself of some overwhelming stress for a few minutes might really help. So for example, if you still have the ability to read, you could sit down with a good book. There are tools available to help you read as well. Watching something funny on TV, even having a hot bath, taking a nap, or the relaxation exercise that we did at the very beginning of this topic. So a lot of these changes, when we go into the vision rehabilitation program presented by CNIB, we will actually be talking a lot about tools that we can offer so that hopefully they are still able to do a lot of the things that they might have lost the ability to do, such as reading small print. So we can just find ways of making the print larger, introduce them to large print books. So having those suggestions and preparing them for the vision rehabilitation presentation, that might build a little bit of hope as well. All right. So, name some things that can keep us healthy while we adjust to loss and change. And each time someone gives you an answer, again, we're going to ask them to elaborate. So some of the answers might include being with supportive people, filling our time with activities that make us happy, talking about how we feel, so whether it be with a close friend, a family member, or an anonymous person. So there are helplines out there that have anonymous volunteers on the phone, and having that, just that voice and having no face associated with that voice can sometimes help. So who are the people that you feel like you need to be with as you adjust to this change? Who are those supportive people in your life? And hopefully we'll get some specifics as to who these individuals feel like they can count on in their lives. So another good way to adjust to any loss or change in your life, especially something like vision loss, is to learn new skills, okay? Or potentially new ways of doing the things we already like to do. So people here oftentimes have difficulty coming up with suggestions. So I've come up with a couple. One is they could learn to play an instrument. And this doesn't necessarily require the ability to read music if they're just learning the notes. And once they are proficient enough to actually read music, it's possible that we can have ways of enlarging the print of the music sheets for them. They could also learn to read Braille. Alright, so if they aren't able to see, or even if they are able to see, this is just simply another skill they can add to their repertoire. And finally, learning a new language. Alright, so there are many audio tapes. They can certainly attend classes, maybe if they'd like to meet other people at the same time, where they're able to learn a new language. And then hopefully we can even get them to the point where they're hopeful of taking a trip so that they're able to use this new skill. Okay. So we're going to talk a little bit about AMD and depression. Depression can be a problem for anyone, but we've actually found that it's more common in people who have age-related macular degeneration than it is in people with the same age who do not have the disorder. So the rate is twice, so it's actually 33% versus only 16 among the rest of the population who does not have AMD. And this is actually comparable, even in some cases higher, than other disorders. So for example, people with other major health issues like heart disease. So people with heart disease are 16% more likely to develop signs of depression. Stroke is 26%, and cancer is anywhere from 25 to 38%. So you'll see that 33% is higher than most of those. Above and beyond affecting just your emotions, the effects of depression can actually extend to other areas of your life. So relationships, they can be very affected by somebody dealing with depression, just simply because it puts a strain on your relationship. Oftentimes, people are irritable, and they might not want to discuss things, so this can deeply affect your relations with other people. It can also affect your physical health. So it's actually been found that being depressed actually increases a person's vulnerability to physical health issues. And of course, it can disrupt concentration and focus. So you might not be as productive as you could be if you were to kind of deal with your depression. And in dealing with it, we'll come up ways where we can cope a little bit better with it as well. We'll discuss that in just a little bit. So research also shows that depression results in poor outcomes regarding functioning. Okay, so this is the competency that we're talking about, and it's related to vision. So low vision functioning is actually worse in people who are depressed, typically, so the research indicates, than are individuals who don't have depression. There seems to be an increase in functionality if depression is treated. Alright, so how do you recognize depression? We'll talk about some signs and symptoms in others, but first of all, let's talk about Joe. So Joe goes to his family doctor, and his family doctor asks how he's been doing. Well, I don't really eat these days. I mean, I'm not doing much anyway, so I don't really need the energy. I sleep 18 hours a day, and I nap when I need to. I get so tired, and there's really nothing else to do. Such a long walk to the bathroom, so I don't really drink any more than I have to. I could stay awake, but again, there's nothing to do. There's nothing to stay awake for. I used to help my sons work on their basements or finish up renovations, and I can't do that now. There's nothing to hope for. It's all downhill from here. Maybe I should just shoot myself and get it over with. So what are some signs we see in Joe that he might be dealing with depression? So he says he doesn't need to eat. So this is a decrease in appetite if he's eating less than he has been. Increase in sleeping. So he's sleeping a lot more than he used to, 18 hours a day. Him not paying attention to his general health, so not getting the right food or liquids that he needs. He's also lost a lot of motivation and interest in things that at one time would have given him a lot of joy. So helping his sons out with renovations. He seems to have lost a lot of hope, so he seems very hopeless. And he's also expressing some suicidal ideation by claiming that he might as well just shoot himself. Now we'll talk about Mary. So Mary actually goes to her ophthalmologist for a follow-up. And he says, how have you been doing lately? Well, I eat probably 7 big meals a day now. I mean, I'll probably go blind, so I better eat while I can still see the plate. I don't dare close my eyes. I might not be able to see when I wake up. I broke my toe, actually, running for the phone the other day. I thought it might be the doctor or my son or, maybe even somebody offering me a sale on shoes or makeup. It might not have happened if I wasn't brushing my teeth and carrying my coffee cup at the same time, and then I had my day planner, so I had to figure that out. My mind is just racing, and I can't seem to focus on one thing. I'm exhausted, but I can't sleep. Oh, I've also quit knitting.
if I lose my eyesight, I won't be able to knit anyway, so I might as well get used to that. I'm no good to anybody these days, you know. My daughter's gonna put me wherever she wants, and there won't be anything I can do about it. I just almost figure it would be better to just die now before things get worse. So what are some signs that Mary's might be dealing with depression right now? That she might be, that she could potentially be diagnosed with depression? So, for example, she's eating 7 meals a day now, so she's eating more than she was in their big meals, so she's overeating. She can't sleep, even though she's exhausted. So it's a little bit different from Joe, but any change in eating or sleeping pattern besides the norm could be a sign of depression. And the norm for that person, so everybody's a little bit different. Her inability to focus on one thing, so she seems to be multitasking and she can't concentrate. And again, she also seems very hopeless, and she is expressing some suicidal ideation as well. So mentioning that, you know, it might just be better if she were to die now rather than later. So what are some signs, either in yourself or in others, that might indicate depression that you've noticed? And then we'll get the group to answer these questions. We're going to assume that they're comfortable. Hopefully they will have noticed signs or have had friends that have dealt with depression if they haven't themselves. So some expected answers, again, sleep disturbances, appetite disturbance, slow or rapid motion, trouble concentrating, feeling really lethargic, uninterested or disinterested, feeling like a failure or hopeless, and again, that suicidal thought. So then we can ask, have you ever had depression? You know, if you're comfortable answering it. And how did you know it was depression rather than just a really bad day? So the way we typically know that it's depression is because it lasts more than just that one day. Typically it lasts more than 2 or 3 days as well. So if we find that we're not able to kind of shake this feeling, we could be dealing with depression. Everybody has bad days, and it's understandable. Some days you're just more down than other days. But if that persists, then we might have a problem with depression. So how to recognize depression? So again, we'll just reiterate now on the slide. Changes in appetite or weight. Again, different from what is normal for that individual. Change in sleep patterns, so are they sleeping a lot more than they usually do or a lot less than they usually do? Being withdrawn or isolated. So this isn't something that's been touched on yet. Just the fact that, you know, a lot of the times individuals are withdrawing themselves from situations because they can feel like a burden. And when that happens, oftentimes the other people don't know how to react and might assume the person wants to be on their own. In turn, the person who is withdrawn themselves feels more isolated. So it's sort of almost like a cycle. And it's not getting any better because nobody's addressing the issue. So that isolation persists. There's going to be a lack of energy and motivation to do things that, you know, at one point you might have really been excited to do. People who are depressed can also be very irritable, so you might recognize that person's mood has changed and they're a little bit snappy or short with you. And finally, suicidal ideation. So suicide is something that is a more common issue than most people believe. So more people are dealing with thoughts of suicide than we would expect, and oftentimes it helps to discuss this. If you are not comfortable discussing this with somebody, there are helplines out there that people can call, and they can certainly speak with somebody. When people have suicidal thoughts, it's not necessarily that this person wants to die. I mean, realistically, nobody wants to die. So these individuals are often what's called ambivalent. And this means that they're sort of caught in the middle of this struggle. The struggle is between, on one end, they want to live and they want things to get better. And on the other end, it's not that they want to die, but they want to end whatever pain they're feeling. And this pain could be emotional, it could be physical, mental. So any pain they're feeling, they want that to be over. Okay? And ambivalence isn't necessarily a bad thing because it means that they're not decided on one side. All right, so in dealing with depression, can you tell me what has helped someone or yourself deal with depression? So it could be someone you know, a family member, a friend, or even yourself if you feel comfortable sharing. And then we're going to give them the opportunity to share things that they can do. We can go through, again, some ideas as far as coping, so short-term, things that they might enjoy doing just to refocus their mind, those relaxation exercises, watching something funny on TV or taking a nap, something a little bit more long-term, so there's some resources we can offer them, consulting with a family doctor, seeing maybe a counselor. There's also a program called 211 Edmonton, and just by dialing 211 on the phone, you can have them connected with social health and government services specific to seniors or any population. All right, so those are longer term support and making sure that they have somebody that they feel they can confide in. So it's really important that we get help in dealing with depression if signs of depression persist. So again, we can have bad days. We can feel depressed and not have depression. Okay, so if these feelings, they only last maybe a day or two, 3 max. If they're persistent and they will not go away, we want to make sure that we are trying to find some other ways of dealing with it. And this can mean, again, accessing any of the resources that we give them. Self-awareness wheel. Okay, so here's an exercise that we can do as a group, and you can also do it as an individual. This can be for anything that you're trying to cope with. So you could have a fight with your spouse. You could have a different diagnosis. You could be dealing with the death of somebody. So you might have just lost a loved one. So any issue we're going to put in the middle. Okay, so what is the issue? So let's say, for example, you've been diagnosed with Age Related Macular Degeneration, and you're struggling with that a little bit. So this is an exercise that will help you recognize your own emotions and hopefully will create sort of a goal for yourself. So we're first going to explore at the very top there, what have you sensed? So this is going to be, what are some things that you've seen or heard that sort of create this issue? What happened? What do you believe the preconceived notions are about, let's say, AMD that make this an issue? So, for example, what have you sensed? You can say there's a preconceived notion that people with AMD will always go blind, and that you will lose your license, and you're not able to read anymore or recognize faces, and this is, this isn't something I want to deal with. So these are the things you've sensed. You've heard that AMD is a disorder that affects your central vision, and you're afraid that you're not going to be able to read, recognize faces, or drive anymore. What are your thoughts? Okay, so here you can put those beliefs, judgments, or influences. So I might not be able to drive anymore. I could lose my independence. I'm concerned I'm going to start experiencing more vision loss, and then I'll have to do many of the things, stop doing many of the things that I already really enjoy doing. I think I should stop doing them now so I won't feel so bad later. You can also positive things in here. So this doesn't always have to be negative. So what are your thoughts? I think that I might be able to get through this. The injections seem to be helping, and I might not have as much vision loss as I would have initially thought. Okay, so put any and all thoughts you have about this. Positive, negative, in between, uncertain, put them in there. And that holds true for any of these sections. So then we're going to talk about how do you feel. So only put feelings in here. Try to avoid the term I think. I feel that I think, because those aren't true feelings. So feelings are anger, frustration, sad, maybe happy, maybe relieved. And you can put the reason why you feel those things, but make sure you're focusing a lot on those feelings. So I'm angry because I have this diagnosis and there's no cure. I'm relieved because the treatment that I'm getting seems to be helping. I'm sad that I have to get injections as often as I do. What do you want? So what are your hopes for the future? And these should be realistic hopes, okay? So although you might want to, let's say, be able to drive, a more realistic hope might be that you want to be able to independently get yourself around in the future. And I won't limit what you put there. If you want to put that you want to still be able to drive, you certainly can. But in the next section, it's what do you already do, or what will you do, or can you do, so that you can achieve those goals. This is why these hopes and desires or intentions should be as realistic as possible so that you are able to work towards them. So again, if your goal is to independently get from place to place without having to rely on anybody, maybe your way of working towards that in the future is to learn the bus routes. Start taking the bus now so that you get more familiar with how to do it. Having 3 people on call in case you need to make it to an appointment, and just having those conversations with them to make sure you have those backups. So again, you can use this for anything. Just make sure you're being completely honest in this, not just focusing on negative, but bringing in those positive thoughts, feelings, and desires as well. All right. So when it comes to living well with AMD, although you may be dealing with vision loss and a lot of changes in your life, you do have an opportunity to learn new things. So it's important that you think of this as a time of learning as much as it is a time of change. What are some things you would like to learn to do now? So a nice motivational quote is, "May you always find new roads to travel, new horizons to explore, and new dreams to call your own." You should be very proud of anything you accomplish, okay? Even if it's a subtle little change that you've accepted or that you've learned a new skill, boast about new things that you've learned. You know, make sure you are surrounding yourself with supportive and positive people. It's much more pleasant, and we gain much more from it, speaking to somebody who uses the word can, will, or able versus can't, won't, or who have a generally negative disposition. So it's important that we surround ourselves with that positivity and people who support us in learning new things and new skills or new ways of doing things. We're put on this earth not to see through each other, but to see each other through. So we're just going to reiterate some things here. Just kind of closing on a positive note, try and think about right now what kind of person you want to be. All right? And if these individuals feel comfortable sharing, we want to encourage them to share. What kind of person do you want yourself to be moving forward? We're also going to ask, where do you get your inspiration? Okay, it can be from a person in their life. It could be from an activity that they do. It could be from a person who maybe isn't in their life, but that they truly admire for any reason. What makes you laugh? So laughter is very important, and it's often very therapeutic. So humor. What makes you happy? So ask these questions, and hopefully at this point people are, we've built hope kind of throughout this whole process, and hopefully they're willing to share. So we just want to make sure that everybody, in order to live well with AMD, that we're spending time with people who make us feel better. All right, so surrounding ourselves with those supportive individuals, that we focus less attention on what we cannot do and more attention on the kind of person we want to be. We also want to find opportunities for joy, for inspiration, and for laughter. And finally, we would like to share a video with you that explains a little bit about kind of how this project came to be, and we'll introduce some real-life champions of AMD who have learned to live well with age-related macular degeneration and have even dealt with depression.
At that size, I was 3'4", 6".
Retired after a lengthy career as a medical doctor and provincial politician, Winston Bacchus has been blinded by macular degeneration. The doctor knows firsthand blindness affects more than eyesight. Patients need help learning new ways to do the things they love with less vision.
They go through the stages of grief. The first stage, of course, is denial. They say, oh, this is going to come back, my sight's going to come back. And then you can easily go into a state of depression.
Not far from the retirement home of Dr. Bacchus, another physician is just starting his career. Practicing as a resident in an ophthalmology clinic in Edmonton, Dr. Imran Jibraj became concerned about the level of depression he saw in some patients diagnosed with macular degeneration, and specifically age-related macular degeneration.
While we were doing everything possible to treat his eye condition, he had started to sink into a bit of a depression. And at that time, he actually revealed to me that he was suicidal.
Dr. Jibraj wondered how many other people losing their eyesight felt the same way. He decided to research the prevalence of depression in people with age-related macular degeneration.
The rate of depression in patients in Edmonton with macular degeneration is almost double that of their age-matched peers. So we felt that it was our obligation as ophthalmologists, but also as medical doctors overall, to begin to screen for mood disorders within our clientele, to find out how many of them have mood disorders that are not being diagnosed.
So I was forced to leave my job, of course, because I couldn't see properly, and I think I just moved out to the sacred here. And I'll tell you that sinking feeling, it's like, oh my God, we wouldn't have moved from the city out to the country. Knowing this, you go through the same thing as you do with death, more or less. You do get mad. You want to say why you don't want to people. It just really actually it really comes into your life. And you say, well, I might as well be dead.
Hearing stories like these, Dr. Jibraj realized there was a gap in access to support for patients battling macular degeneration. This discovery led to a new partnership. Alberta Retina Consultants, University of Alberta's Department of Psychiatry, counselors, and the CNA.
Patients were newly diagnosed and learn about the treatments, the technologies, how to diagnose the condition, how to treat it, what the risks are, and what they can expect.
One of the things that we know that we need to do at CNA is get them connected to the counseling and support and the services like independent living services so that they can get reconnected and do the things that we used to do.
CNA offers everything from white canes to readers to gadgets that make life easier in the kitchen. But seniors losing their sight are often slow to accept help. That can lead to feelings of depression counseling psychologist working with CMLD to support seniors. She can find common ground in these conversations because she herself is one. He strongly believes people can have good mental health even when their vision is failing.
If we can improve people's mental health, then they are much more able to see possibilities and take advantage of things that are available to them. Help individuals to start thinking about hope and feeling a sense of hope for the future, and the confidence, having to build the confidence so that they can follow their dreams.
Dr. Winston Bachus credits CMLD for helping him both accept his blindness and discover he still has a lot to offer. He leads a support group and speaks about macular degeneration on behalf of CMLD.
By virtue of having lost my hearing last year, I can see and hear better spiritually, and I can service to this. And in fact, that was what made a terrific difference to me in coping with my visual impairment.
Despite her blindness, Anne Wayland is always out in sunlight. Anne volunteers at the local CMLD office. She runs Alberta's largest peer support group for seniors with vision loss. And she supports fellow residents on her lodge, where she's president of the Residents' Council.
That's what's really happening in doctors. There's so many things that can get to help for that, and getting out working with the groups.
Get help. If you feel you need, if you're scared, you're depressed, you don't have anywhere to turn.
The CMLD sees a whole range of individuals, from those that are simply dissatisfied with their current vision, to those who are completely blind. There's a huge spectrum of people who function well in society but have lost some vision and want to know how best to optimize it.
Many people who are very sad and very fearful about their future at one point do surprise me by how well they do and how quickly they make adaptations. Anything that we can do that helps them adapt faster and more quickly is important.
As their partnership with the CMLD matures, Alberta Retina Consultants are hoping to expand this program from coast to coast.
We're hoping to make vision rehabilitation and visual counseling and visual and vision education a core part of their ophthalmologist practice, not even just for macular degeneration, but for all diseases.
And again, this would not have been possible without Mullenfield Family Foundation supporting our research and funding it. So thank you to them.